Hey everybody, thanks for watching. This is part of our ongoing series with questions and answers with Dr. Shaw and Whitney. Today we're going to be talking about fillers. I think one of the other things that patients hear out there that we get asked a lot about is you hear Botox and filler, right? And I think those often get kind of clumped together and it gets confusing for people of what do we use Botox for versus what do we use filler for? So, maybe kind of help clarify those terms, for patients who might not know. Do I need Botox? Do I need filler? Do I need both? It can be confusing.
Right, because we even hear it out there as Botox fillers.
Right.
They're clumped together as being the same thing. But Botox is a neurotoxin. So it's going to work within the treatment area to stop those nerve impulses from communicating with the muscle. So then that muscle's not contracting. And when that muscle's not contracting, we're not going to see the skin folding over top. So that's going to be how we're preventing, frown lines or forehead lines. You're not going to be able to move those muscles as much. And when you're not making those lines every day, they never get the opportunity to fully settle in. And if we have some lines there when we start Botox, those now get the chance to relax back out. With filler though, filler is hyaluronic acid. It's a sugar molecule naturally found in the body, and it hydrates our skin. It hydrates our connective tissues. It binds with water. So we're gonna use that to plump and fill. So we can use that for volume replacement, where we've seen volume loss with time and age, maybe even weight loss. And we can use that to smooth lines that maybe we don't want to stop the muscle movement in that area. So consider smile lines and things like that. We don't want to stop you from smiling, but we can use a filler to soften the lines that you might see.
Yeah, and I think now, as we've evolved in the different treatments that we have at our fingertips and our palate, is that it's really nice now to be able to do combination treatments for patients, to be able to offer something for, say, the upper face and some dynamic lines with Botox, and then combining that with some volume replacement at the same time.
Absolutely.
Yeah, that's been really something. Fillers have really changed the game in the aesthetics industry. When I was starting, fillers were kind of new, and everything at that time was really surgical. You had to cut and pull, but now we've sort of taken a really close look at volume replacement and how we lose volume over time, and fillers have really been revolutionary and really have made, for me, a difference in how I practice, even as a surgeon. And at the end of the day, the most important thing is how the patients like it. And patients, you do some filler on patients and you show them the mirror and it's like, wow, it looks really great. So big fan of combining those treatments, and I know you do an amazing job with both of those.
We hope you found this information helpful. If you have any more questions, just give us a call. We can always set up a consultation.